California Pediatrics, a podcast by pediatricians from the 4 California chapters of the American Academy of Pediatrics, AAP California Chapter 1, 2, 3, and 4. 4 chapters, 1 state, 1 voice. In 4, 3, 2, 1.
Hi, I'm Melissa Ruiz. I'm an outpatient general pediatrician, and welcome to California Pediatrics, where we discuss pediatric topics and we go through the professional journey of our guests.
And my name is Dr. Eric Ball. I am a primary care pediatrician in Orange County, California. And our guest today is Dr. Colleen Kraft, and we are going to be discussing advocacy in pediatric training with Dr. Kraft. Dr. Kraft, thank you so much for joining us today.
So glad to be here.
So you've had an amazingly distinguished career in pediatrics, working in major pediatric institutions, going all the way up to becoming AAP president. So start at the beginning. Tell us, how did you get involved in pediatrics and in advocacy in general?
Well, I started in pediatrics very, very young. My parents were married in the late 50s, had their kids in the early 60s. I was the oldest of 6 kids. They were an Irish Catholic family, so the first 4 of us came one year after another. In fact, I thought growing up that you just got a baby every year. That, the baby went to the crib and the kid who was in the crib just went into the room with everybody else. And so one of the things I started doing was, quote, reading to my siblings. So as little kids do, they take a book and they know when to turn the page and they know what's going on with the story. And I would do that with my kids, with my younger siblings. And during the process, I actually did learn how to decode, so I could read at age 4. Well, right around that time, 4 to 5, there was a new program that was starting out in the United States that took poor kids, and we were from a poor family, and gave them an educational experience to get them ready for school. The program was called Head Start, and I was in the first year in 1965.
Oh, that's so cool.
And my mother thought it was a great idea that I would go to this summer program. And lo and behold, the teacher found out that I could actually read. And she looked at me and she said, you are so smart that you could become a doctor when you grow up. And that was it. I knew that that was what I had to do. So this was a little bit of the reverse. It was taking the social determinants of health. It was actually applying a solution and then starting a trajectory into medicine. So fast forward about 24 years after that, I finished up with residency. I had 2 kids. My kids were 3 and 1, and I was pregnant with my 3rd. And my problem was I couldn't find decent childcare. And I went and interviewed many different places, and I found one institution where it was passable, and I enrolled my kids, and I sat down with the director and talked with the director, and I said, I would be willing to come in an hour a week and do an in-service with you and with your staff. We can do it while the kids are sleeping. I'll bring my kids, and they can take nap time with everybody else. And we're going to talk about infection control measures and healthy nutrition and playground safety and hand washing. And so we did that. And I found out 2 things. The first thing that I found out was that the women who were taking care of my children couldn't afford to have their own kids go to that child care center. And then the second thing was that they were so ready to learn. They were like sponges. And so we would talk about a topic, we'd talk about what to do differently, and then we would just add to it each week. And they looked forward to the sessions. I looked forward to seeing what the changes were in this child care center, and they were pretty amazing. So about a year after that, I got a call from our state health department. And they said that they had gotten some grant money to improve childcare in the state of Virginia. And they would like to use my curriculum. And I said, my what? This little thing I'm doing with the child care center? And they said, yes. I mean, we've heard all about it, and we want to actually do that. And so I became part of the group that actually put this together for Virginia. And one of the things that I learned right away, because they said, we would like to make this like a pass-fail system, that you do these things, you pass. And I said, if you do that, you will drive the family centers underground. Yeah. You will not know who they are. So instead, what you ought to do is this. if you have this, this, and this, you get 1 star. You want to start adding infection control measures, you get 2 stars. If you have fruits and vegetables in your diet, you get 3 stars. And people will want to climb that ladder. They'll want to do that because they want to do the best thing for the kids. And so it started the 5-star quality program that actually is still going on in Virginia today.
That's amazing.
So from there, what we were able to do, because there was a lot of national conversation at the time about investing in early childhood. And James Heckman from the University of Chicago came up with a 1 to 7. So every dollar invested had $7 return. So in Virginia, our governor at the time, who's Tim Kaine, took that message and had different leaders go to different business roundtables. And he then started something called the Virginia Early Childhood Foundation, where money was appropriated, and the board of the Virginia Early Childhood Foundation were CEOs of companies in Virginia, places where you couldn't outsource your employees, places where you need your employees to show up, to not be sick, to not be alcohol or drug addicted. You know, we needed those adults, and they were very intent on looking at early childhood and funding early childhood. So what happened was there was a pool of state money, and then there were different communities throughout Virginia that decided to go for a piece of this funding. And what they did was they came up with their own list of what they wanted to do to encourage early childhood education. So some communities, it was getting home visiting started. Some, it was universal pre-K. Some of it was vouchers for working moms. And what happened is that the small communities would get a 1 to 4 funding, and they were able to do these programs. So what I learned was this. When I was a little kid, going into a program that really helped to encourage early childhood education really set off my career. And when I was a mother of young children, getting involved in that system, first at that local level with the child care center, secondly at our state health department level, looking at what we could do for the state, but third, working with our legislators and business leaders. And that set the stage for how do I, as a pediatrician, look at that child and take what they need, not just inside the office, but outside the office, not just inside the hospital, but outside the hospital. Because if we're going to do our job as pediatricians, we need to make the environment outside our offices and outside the hospital better than what it is right now. There's limited things we can do inside the hospital. It's got to be outside the hospital as well, too. And so that is advocacy. That, in my mind, is advocacy. Advocacy can start with identifying a problem like I can't find good child care, or too many kids are dying from gun violence, or we have kids who are undocumented immigrants that we're having trouble caring for because their parents are scared, or so many of our families are food insecure. And it's taking that and it's actually working on that problem. Now, as a pediatrician, you're busy. You're not going to be able to solve it on your own. And the good news is that you don't have to. So advocacy education starts with knowing what your purpose is, finding out and identifying that problem, but working with somebody who works with that. So one of the groups we worked with in Los Angeles was a nonprofit called Each Step Home. What they did was they actually reunited the parents and kids who had been separated under the first Trump administration. And those kids needed medical care. So we worked with them and we developed a process by which we would be referred these kids and families. We could work with our local federally qualified health center to provide the appointment, to get transportation, to get Medicaid set up, to get that family in there. And about 50% of those kids missed their first visit because parents are scared.
Right.
We would call them and say, we missed you. We really want to take care of your child. We know that you want to take care of your child as well, too. So can we reschedule this for next week? And almost all the parents came the second time. And after we found dental care and mental health, if kids had some trauma issues, or just developed that primary care medical home relationship, things got much, much better, and we could expand from there. So the first thing that you want to do is identify the problem. The second thing is work with people who are already working on that problem and lend them your pediatric expertise. One of the things I tell my residents all the time is that you know more on the first day of internship about child health than 99.9% of people out there. And so any organization that's going to serve kids is going to want you there. If you can come once a month, if they can interview you off times, if they can call you if they got a question, they're going to want to do it. So that, in fact, is there in this advocacy.
So what would you say the next step is in that process of pediatric advocacy education?
Well, I think that after you have that established program or project, it's knowing how to talk about it.
Yeah.
It's knowing who to talk with about it, whether it's your hospital leaders, whether it's local leaders in your community, whether it's parent groups. Know who your audience is and who would want to know about this.
So I think you're an amazing personal example of how $1 of money that goes into Head Start leads to much more than $7 worth of benefit. So your experience when you saw a problem, especially with the childcare when your children were younger, I know a lot of the people who listen to this podcast are trainees, so they're pediatricians in training or medical students or early career physicians. So once they've kind of established that problem that they want to tackle and gotten the group together to tackle it, and then have started to put it out there and try to publicize and go take that next step, how do you make the leap from working locally to maybe doing something on a bigger level, like you were doing things on a state level, or even you've been AAP president, like maybe not that much, but how do you get it to be even bigger?
I think that what you wind up having to do is figure out where you're going to publicize it and talk about it. So you can write about it, you can post about it in social media, you can present it to a parent group, you can present it to a local legislator. Sometimes if you're looking to go to those bigger groups, what winds up happening is you'll look to see, is there legislation about improving childcare? Is there legislation about resources for doing this? It's a good thing to find out, because if there is, then you can call that legislator's office and talk about what it is that you're doing in your community that is a success and that's positive. Because people talk about problems all the time. They don't talk about solutions. When you got one, you got to talk about it.
Yes, absolutely. And how, I think that residents often come to me a little nervous, right? Because I don't think they feel like they're experts. And I think you said, you sort of try to talk them up, but could you speak a little more to that?
Sure. So residents come in and they feel like they're at the beginning of their training. And there's a lot that they know, and there's a lot of their wisdom that's appreciated by groups who are not pediatric groups. They just don't know that. And you have to really encourage them to share it.
Yeah.
Now, some of the resident advocacy curriculum, because it has been formalized in a lot of places, and in California, we have 9 pediatric residency programs that have advocacy curriculum. So some of the things that do help out the residents are knowing some basics of public health, some basics of statistics in your community, the resources within your community, all really good things. But what's most important for the residents is letting them know the power of their own voice and what it is that they've done, and that people want to hear about it.
Yeah.
What are some things that your residents at Children's Hospital of Los Angeles are working on right now from an advocacy perspective?
We have a group that's working on gun violence prevention. And where this group started out was they actually looked and did some GIS mapping of areas where there was the greatest amount of gun violence in Los Angeles, and then mapped that against something called the Child Opportunity Index, and saw that places where there was less child opportunity, there was higher gun violence. So you take that and you look at, what do you do with it? So the next group that came along thought, well, there should be some education and some understanding about this. as well as resources to improve that child opportunity index. What happened after that was that we met with legislative leaders and did a needs assessment survey of where that child opportunity index was. And that really became a very separate project, but we started doing a lot of curriculum with regard to gun violence, particularly safe storage, when to use firearms, where firearms are stored in your household, and let families know where the safe ways of storing firearms are.
I think that story is a great story about how residents can get involved, because I think sometimes there's so many things going on that are really daunting, and it's overwhelming to see all the things that are wrong in the community or the country that we want to try to fix. And what that story tells me is one group did a small bit that passed it on to another group that was able to take that and move it on to another group. So longitudinally, each year, you seem to make more and more progress towards your final goal. So you don't have to fix gun violence in your 3 years of residency. You can take a little piece and then pass that on. So no, I appreciate that.
You're absolutely right, Eric. It is do the easy things first.
Yeah.
So identify what's going on there. Our group right now is doing 2 projects. They have worked with our EPIC team at Altamed, and they've got gun violence screening questions now that all of our families are asked. And then most recently, they've developed a partnership with our Los Angeles Department of Health, who have trigger locks. And so now if a parent screens positive for having a gun in the home, they get a trigger lock. So it's something that they can go home with that is really proactive.
Yeah, that's awesome.
Could you speak? I think you talked a little bit about kind of that, kind of some basic knowledge that it's nice to empower residents with. If we were going to talk about kind of the big pieces of an advocacy curriculum or advocacy training in residency, I hear that being part of it. And then what do you think some other kind of foundational blocks look like?
That's a great question, because knowing, first of all, some of the social determinants of health, how you find out about them in your area, and then pieces of how you communicate. So media training, how you write an op-ed, how you actually meet with a legislator, how do you look at a bill that may be coming up there and analyze a bill, and then how do you talk to legislators when you were actually either in Sacramento or home at your local office. How do you provide that expertise? Give them your card. Let them know that if they've got questions, they can reach out to you. All really important and really foundational pieces of advocacy training.
Yeah.
Are these things that you're doing now in your I mean, when I was a trainee, I didn't get any of this, and you kind of learn as you go along. But these are things that are being actively taught now in medical schools and residency programs?
They are definitely being actively taught now in California. So at Children's Hospital Los Angeles, where I'm faculty, we have our advocacy track. It's called IMPACT. That stands for Improving Medicine, Pediatricians, and Communities Together. And actually about half of our residents are in IMPACT. So there is a curriculum looking at community health. We have some of our residents doing global health as part of that as well, too, and some of our residents that are doing quality improvement as part of that. So there is a dedicated curriculum there. But California also has 9 residency programs that are involved in advocacy training.
Can you talk about how those residency programs are working together on a state level to try to make change?
Yes, we actually have a joint curriculum between the 9 residency programs, and we have different people sign up to do a program that may be talking about early childhood, or maybe talking about immigrant health, or maybe talking about immunizations. And then that's the first half of that training. The second half of the training is a skill building. So it may be how to work with social media and your message, how to write an op-ed, how to contact a nonprofit organization. So this is something that all 9 of our residency programs are involved in, and our faculty have a seminar every couple of weeks throughout the year for our residents.
When we talk about advocacy training, I also think about the work that you actually did going to the child care centers and working with community organizations. What do you think are some kind of fundamental aspects of teaching residents how to work with those kind of community-based organizations?
Well, one of the fundamentals is don't be afraid to call and get out there. So one of the the things that we do at CHLA with all of our interns is we take them on a community walk. What within 5 minutes of the hospital can you find that might actually be helpful for your patients? And it could be a thrift store. It could be a nonprofit organization. It could be a grocery store where you can look at where is the formula. Well, the formula is locked behind a cabinet. Where is some things like Anito and some of the high caloric things that our parents use? And that's out in the open. You know, what if you were a parent, which one would you might pick? You know, and so really understanding where the resources are and where some of the barriers are that our parents come from.
So as we wrap up, I wanted to see if you had any final words of advice for our pediatric trainees of how they can get involved. How do you take that first step after you've identified a problem and want to move forward with trying to fix something?
That's a great question. So if you identify a problem, first of all, look up the people who are working on that problem. Mm-hmm. So if it's food insecurity, if it's immigrant child health, if it's lack of access to contraception, look and see who's doing that. Call them and make an appointment to talk with them. You can do that virtually. You can go and do that in person. You can find out where you can volunteer. They may have a board member that may want to talk with you about things. You might want to find out what projects they're actually working on and if you could become part of an advisory group for one of those groups. And know what you can do, knowing that you're not going to have a lot of time. But they're going to know how to use your expertise and what you know right now to be able to work on a project and get some results together.
Well, thank you so much. This has been a wonderful conversation. I really appreciate your time today.
Thank you so much for joining us today.
Well, thank you for having me. And I think advocacy is in our DNA, and it's going to be in part of our training too.
Yeah, absolutely.
Melissa, that was a really great conversation.
It was awesome. I'm so excited because I'm in this space where I'm really doing a lot of advocacy and residency education in my new position, and it was just such an exciting conversation to be having right now.
And I've gotten into advocacy as I've kind of moved on in my career, and I wish I would have had all of this training when I was a resident.
Yeah, absolutely. I think like formalizing it and really incorporating it into a resident education is vital, and I love how she said advocacy is in our DNA, and yeah. Absolutely it is.
It's what we do, and I think every day we see something in our clinics or in our communities that we wish we can change and work on, and it's great that we're giving our residents the tools to make those changes.
Yeah, absolutely. Well, thank you for joining us today in California Pediatrics. Please comment and join us again next time.
Thank you so much. We'll see you next time.